Hello everyone! Today we're talking about a common problem, diarrhea. It's something that affects people of all ages and backgrounds. Diarrhea means you have loose, watery stools, and might need to go to the bathroom more often than usual. It can be quite uncomfortable and inconvenient. Most of us have experienced this at some point in our lives. It's a universal issue that can strike unexpectedly. It's usually not serious and goes away on its own. Often it resolves without the need for medical intervention. Your body often uses diarrhea to quickly get rid of something bad, like harmful bacteria or a virus. It's a natural defense mechanism. Think of it as your body's cleaning system working overtime. It's trying to flush out the invaders as quickly as possible. Usually diarrhea is a temporary visitor, lasting a day or two. It comes and goes, leaving you feeling better afterward. But what happens when it keeps coming back? This is recurring diarrhea. It's more than just a one-time issue. It means you have episodes of diarrhea again and again, which can be very frustrating and disruptive. It can interfere with your daily life. This pattern needs a closer look. It's important to understand why it's happening and what can be done to stop it. Imagine always worrying about where the nearest restroom is or feeling anxious about eating out. This can be very stressful. This constant concern can lead to stress, which can make digestive issues worse. Stress and anxiety can exacerbate the problem. Understanding why it's happening is the first step towards finding relief. Identifying the root cause is crucial. So, in this discussion, we're going to dive deep into recurring diarrhea. We'll look at various factors that could be contributing to it. We'll explore common reasons, symptoms to watch out for, and what you can do about it. This will help you manage the condition better. This includes prevention tips, dietary changes, and knowing when to talk to your doctor. Making informed choices can make a big difference. Knowledge is power, especially when it comes to your health. The more you know, the better you can take care of yourself. Let's get started on this journey to better gut health together. We're here to help you every step of the way. One common reason for recurring diarrhea is infections. These infections can be caused by various pathogens, including bacteria, viruses, and parasites. Bacteria like E. coli or Salmonella, often from contaminated food, can cause diarrhea. These bacteria can be found in undercooked meats, unpasteurized dairy products, and even some raw vegetables. Viruses like norovirus or rotavirus are also big culprits. These viruses are highly contagious and can spread rapidly in places like schools, cruise ships, and nursing homes. Parasites like Giardia from contaminated water can also be a cause. These parasites can be found in untreated water sources such as lakes, rivers, and even some swimming pools. If these infections aren't fully cleared or if you get re-exposed, diarrhea can return. It's important to follow your doctor's treatment plan and take all prescribed medications to avoid recurrence. Another major player is food intolerances. These intolerances can cause chronic digestive issues if not properly managed. Lactose intolerance is common. Your body struggles with lactose in dairy products. Symptoms can include bloating, gas, and diarrhea. Fructose intolerance and gluten sensitivity can also lead to ongoing digestive upset. Reading food labels and avoiding trigger foods can help manage these conditions. Identifying these trigger foods is key. Working with a nutritionist can help you create a diet plan that avoids these triggers. Traveler's diarrhea is another cause. This condition is often caused by consuming contaminated food or water while traveling. Exposure to new bacteria and viruses in food and water while traveling can lead to diarrhea. It's advisable to drink bottled water and eat well-cooked food when abroad. Frequent travel can lead to repeated infections, causing recurring diarrhea. Consulting with a healthcare provider before traveling can help you take preventive measures. Basic food hygiene is crucial. Washing hands thoroughly before eating or preparing food can prevent the spread of harmful bacteria. Not washing hands properly or eating undercooked food can introduce harmful bacteria. Always ensure your food is cooked to the right temperature. Cross-contamination in the kitchen can also spread germs. Using separate cutting boards for raw meat and vegetables can help prevent this. These habits can lead to repeated infections and recurring diarrhea. Adopting good hygiene practices and being mindful of food safety can make a significant difference. Sometimes, recurring diarrhea isn't just about a simple infection or food intolerance. There can be deeper, more chronic conditions at play. One common one is irritable bowel syndrome, or IBS. IBS affects your large intestine and can cause frequent abdominal pain, cramping, bloating, and urgent diarrhea. Stress can make IBS symptoms flare up. Inflammatory bowel diseases or IBD include Crohn's disease and ulcerative colitis. These conditions cause chronic inflammation and damage to your digestive tract. Diarrhea is a common and persistent symptom of IBD. Some medications can cause recurring diarrhea as a side effect. Antibiotics can disrupt your gut's natural balance, leading to diarrhea. Other medications like certain antacids, cancer drugs, and drugs for heart conditions or diabetes can also cause diarrhea. Celiac disease, chronic pancreatitis, and thyroid problems can also cause persistent diarrhea. A thorough medical checkup can help uncover these causes. The most obvious symptom of diarrhea is loose, watery stools. You'll also likely need to go to the bathroom more frequently. This change in consistency and frequency is the hallmark of diarrhea. Along with bowel changes, you might experience abdominal cramps and pain. Bloating and gurgling in your stomach are also common. Another symptom is urgency, a sudden, strong need to have a bowel movement. This can be distressing and disruptive. In some cases, you might also experience nausea or vomiting. Diarrhea can make you feel generally unwell and fatigued. If an infection is the cause, you might develop a low-grade fever. Recognizing these symptoms can help you understand the nature and severity of your diarrhea. This can guide you towards the best course of action. Section 5. When diarrhea becomes a red flag. Knowing when to worry. Most of the time, diarrhea clears up within a day or two, and it's usually nothing to worry about. However, if it lasts for more than a couple of days, it's time to pay closer attention and consider other symptoms. For adults, diarrhea that persists beyond 2 to 3 days warrants a call to your doctor to discuss your symptoms. For children and infants, even 24 hours of diarrhea can be a concern, and you should contact a pediatrician promptly. Dehydration is a big worry with diarrhea, especially in young children and older adults. Watch for signs like dark yellow urine, dry mouth, and dizziness, as these can indicate dehydration. Severe pain in your abdomen or rectum, blood in your stool, or a high fever are red flags that should not be ignored. Don't try to tough these symptoms out. Seek medical attention immediately to avoid complications. If diarrhea keeps coming back frequently, see your doctor to discuss potential underlying causes. This pattern suggests an underlying issue that needs to be addressed, such as an infection or a chronic condition. Unexplained weight loss or diarrhea that wakes you up at night are further indications to consult your healthcare provider without delay. They can help figure out what's going on and get you on the path to feeling better, ensuring your health is back on track. Section 6. Your gut's best friends: dietary changes to prevent diarrhea. When dealing with diarrhea, choose foods that are gentle and easy to digest. The brat diet, bananas, rice, applesauce, and toast, is a well-known approach. These foods are bland, low in fiber, and can help bind your stools. Cooked vegetables like carrots, green beans, and peeled potatoes are good options. For protein, plain boiled or baked chicken or turkey can be gentle on your system. Probiotics can be fantastic allies for your gut health. You can find them in yogurt with live and active cultures or as supplements. Probiotics help restore the natural balance of good bacteria in your gut. Staying hydrated is crucial. Water and oral rehydration solutions are good choices. Clear broths and weak decaffeinated tea can also be soothing. Avoid sugary drinks, caffeinated beverages, and alcohol, as they can irritate your gut. Section 7. Foods to watch out for: dietary culprits in diarrhea recurrence. Some foods can be major troublemakers, especially if you're prone to recurring diarrhea. Dairy products can cause issues due to lactose intolerance. Fatty, greasy, or fried foods can stimulate contractions in your intestines, leading to diarrhea. Artificial sweeteners like sorbitol, mannitol, and xylitol can have a laxative effect. Spicy foods and an excess of certain types of fiber can also contribute to diarrhea. While fiber is important, too much insoluble fiber can worsen diarrhea. Capsaicin and chili peppers can irritate your stomach and intestines. Moderation is key. Identifying and avoiding your personal trigger foods can significantly reduce symptoms. Your digestive system will appreciate a break from heavy fare. Be mindful of what you eat to prevent recurring diarrhea. Section 8. Lifestyle tweaks and hygiene. Simple steps for prevention. One of the most powerful tools for preventing diarrhea is hand washing. Wash your hands thoroughly with soap and warm water for at least 20 seconds. Do this before preparing food, before eating, after using the toilet, and after touching animals. Careful food preparation and handling are also essential. Cook meats, poultry, and eggs to their proper internal temperatures. Wash all fruits and vegetables thoroughly. Be mindful of cross-contamination in the kitchen. Refrigerate leftovers promptly to prevent bacteria from growing. Managing stress is important for digestive health. High levels of stress can trigger or worsen symptoms like diarrhea. Finding healthy ways to manage stress can lead to a calmer gut. Taking extra precautions with food and water while traveling can prevent travelers' diarrhea. Section 9. Taking control. Summary and when to partner with your doctor. Recurring diarrhea is a signal from your body that something needs attention. It can be caused by repeated infections, food intolerances, or chronic conditions like IBS or IBD. Understanding these causes is the first step towards finding a solution. Prevention is key. Thorough hand washing, safe food preparation, and cautious travel habits. Making smart dietary choices and managing stress can reduce symptoms. Know when to seek professional medical help. Severe diarrhea, blood in stool, high fever, or persistent symptoms warrant a doctor's visit. Signs of dehydration or frequent recurrence also need medical attention. Your doctor can help uncover the root cause and get you on the path to feeling better. Take control of your digestive health with informed choices and professional guidance. You deserve to live without the constant shadow of digestive distress. Stay proactive, stay informed, and stay hopeful.